All right, thank you so much. Here we still have another big guest this morning. We've got the Chief Medical Director of Igbinedion University Teaching Hospital, IUTH, and Deputy Vice Chancellor of IUO, Dr. Nusa Basoaye. One man that is so special when we talk about the stem cell transplants. I remember I had him like once or twice. He's very popular and he's very effective, very, very efficient in that regard. You're welcome to this program, sir. All right, sir. All right, so today is the World Blood Cancer Day. Now, the United Nations, through the World Health Organization, always recognize the blood cancer. And it's very, very pathetic that this has been a big problem, you know, with humans. Little do people know that there are things we can actually do. You're going to be explaining that to us, how we can help ourselves when we suspect anything like that. All right, so doctor, when we say blood cancer, what exactly are we talking about?
Well, thank you very much. It's always nice being on ITV.
You're welcome.
Yes, to start with, on the 28th of May every year, WHO has declared it as World Blood Cancer Day. And the theme for this year is closing the care gap for cancer patients. And then you ask the world, what is blood cancer? The word cancer literally means that something that the body has always been taking care of has lost its control. What I mean now is that there are cells in the body. Those cells in the body, they have a particular quantity. So if your lips, for example, the cells in your lips, by the time you are an adult, they stop growing. So your body controls it. But if the cells there, you lose the ability to control the growth. They grow without control. So cancer is something that we call malignancy, where the body has lost the control of that group of cells. So for blood cancer, there are blood cells in the body. You have the white cells, you have the red cells, you have the platelets, you have the lymphoid cells. These are all different cells. And the body produces a particular amount every time. So there's a range, meaning your white cells has a range. For Africans, for example, it's between 8,500 to between 2,800 to 8,500 cells per microliter. Your body keeps those cells within that range. But if your body loses that control of being able to control those cells to remain at that level, then your body is having what we call a blood cancer. That means the white cells have become malignant. They're no longer under control. Just like when you have cancer of the prostate, for example, it may become bigger or something. So the cells in the body, if it is white cell, if you lose the control of making sure that they are within the normal range, then it means that it has gone malignant. The platelets, the red cells, and even the lymphoid cells, they are at a particular level. So blood cancer is when the body can no longer control the amount of those cells that are produced by the body. And they become completely out of control.
Now, for other cancers, like you have the breast cancer and maybe the prostate cancer, just like what you said a while ago. Now, we see the symptoms. The symptoms at times are very conspicuous, especially for the breast cancer. You see that the cells become malignant, then growth in the breast, abnormal growth and all that. So for the blood cancer, what are the symptoms? Because you just explained that you cannot see those symptoms with your eyes. So what are the symptoms we look out for?
Okay, so that's why the difference between the blood cells and that of
any other cancer.
Those are what we call solid organ malignancies. That's the breast cancer, the prostate. But we're talking about liquid cancer now. Let me use the layman terms. Because blood flows like, flows in the system. So it's difficult to, at the beginning, notice some of these changes. So that's why we talk about routine checkups. And sometimes some people may have blood cancer for years. They may actually start with a chronic cancer. There's different types. You have the chronic type of cancer, you have the acute. The acute is the one that is immediate and will draw attention to yourself. You have symptoms. So some of the symptoms, by the time they begin to manifest, depending on the type of cancer, is that these blood cells, apart from the fact that they are out of control, they're also useless. You know, the white cells of the body, for example, protects you against infection. But once the cell becomes malignant, you are not going to be producing different type of white cells. Only one type of white cell will take over the entire white cells. And I'll give the example. The analogy I usually give is that, for example, you know, in the security force, we have the yellow fever, the one we call traffic policemen. We have the MOPO, the mobile police. We have the soldiers. So if you, for example, these are different cells. I mentioned analogy. If you now remove all this group of military people and replace them only with
one,
no, as simple as the traffic warden. So everywhere you now replace them with that. So though there are many, but they're not going to be effective in terms of security. So that's also to in malignancy, only one clone will proliferate and become in excess. And once it becomes in excess, then it can no longer protect the body. So one of the major signs is that you continue to have infection. Because the white cells, for example, no longer protect you. Although there are many, they may be in thousands now, or millions, but they can no longer protect you because they've lost that ability. It's only one clone that is malignant. So one of the first signs is some people tend to have infection, recurrent infection. So you treat for malaria, you treat for typhoid, you keep treating. But if you go to a specialist and they do your full blood count, as simple as it is, the full blood count may indicate that some of your cells are already going out of control. So infection is one. Then there's what we call the lymphoma. There are three major types of blood cancers. There's one we call the lymphoma. That one affects the lymph nodes. You know, when you have injury in the leg, for example, you get something swollen at your groin. So those things that are swollen are what we call lymph nodes. They drain the body from all those infections and things like that. So those lymph nodes can become malignant. And when they become malignant, we call them lymphoma. And then that one is obvious because you now begin to see some swelling. Yes, you see some swelling in the neck, swelling in the groins, and everywhere. And what most of our people do, native people, is that once an African man sees any swelling, he wants to cut it. So they go to native and then they go cut it, and then sometimes they get infected. So the second kind of sign or symptom is that you see those swellings. Okay? Now another thing is that some of them, you also have the organs are affected. The spleen. The spleen becomes very large. It's some chronic blood cancers. And once the spleen becomes large, the next thing is that most times, you know, we have very good people in, especially the Asian side, they go for markings. Different beautiful designs.
That's the Beninese, they call it
Ude.
Yeah.
So that's one sign too, that you have the organs enlarged. So your spleen becomes enlarged. And once your spleen becomes enlarged, that's another sign that you may be having a blood cancer.
Let's talk more on this spleen now, because I don't know about now. I know those days when we were growing up, it was a common feature with children.
Yes.
Children are of about 5, 6, 7, 8 and all
Definitely.
that. Now, you find their parents, native parents now, taking them to some trado medical care attendants, and they mark them and all that. So are we trying to say that those kids had that kind of cancer then?
No. What happens is that naturally, when you have things like malaria infection or any infection that affects the organs, the spleen temporarily enlarges, but returns back. Because the spleen is like a filtering organ. You know, cells pass through there. When your malaria destroys cells, they are filtered by the spleen. So during that process, the spleen enlarges. But after that, it goes back. So that's the natural response. But we're talking about persistent increase enlargement of the spleen.
So for those kind of parents now that may have those kind of kids, they should know that it's more or less a natural...
Yes, that's a natural phenomenon. So you see, most traditional people may work on your psychology.
On your ignorance.
Yes. So they mark it, but it's a natural response that the spleen gets enlarged and then goes back after the infection process.
But it's also very painful. I didn't have it. But
the marks.
Not the mark now. When it enlarges, it discomforts the child.
Definitely.
It's painful.
Definitely. So, it has to do with the malaria infection.
Are there no ways we can maybe rub to soothe it down?
No. Really, if you treat malaria properly and adequately, you won't get to that level where the spleen, because usually when malaria is resistant and not properly treated, and then the body is trying to adapt to it, that's where you have such complications. That's why if you see the children of maybe the wealthy people, you will not find them complaining of having splenomegaly, because it's a sign that there's a chronic response by the body. Maybe you have a malaria that is not properly treated, they give small doses of agbo and things like that. But if you have malaria in children and they are properly treated, you may not have that response.
Okay, now let's go back to the
blood cancer
thing now. A while ago, you said that one of the symptoms of the cancer, the white blood cells now, when it becomes malignant now, is that your body can no longer fight infection. Now, we have situations whereby persons have multiple infections, hepatitis B, the HIV and all that. Now, would you want to suggest or advise that such people should probably go for blood cell, issue?
No. Usually, we talk about routine medical checkup. That's different. But when you have people having things like infection, it can happen in any other situation. Somebody has hepatitis, you'll be sick. But we're talking about somebody who has frequent, recurrent infection.
What are the frequent, recurrent infections?
Yes, infections, things like recurrent boils in the body.
Boils in the body?
Yes. But as I said, it's not that once you have boil, then the person has blood cancer. But we're saying that one of the signs, salient signs, is that some people will tend to have infection because the white cells are no longer functional. You get my point? So that is just a mild form of presentation. But the other one I mentioned, the swelling. Then the third group of cancer is called the multiple myeloma. That one affects the bone. And that can actually even present with somebody having a fracture. So you discover that some people who have fractures, we call them pathological fracture. They actually may have multiple myeloma, which is the cancer of the bone. And so you see most of them attending trado also with bone setters and things like that. And some can also present with kidney failures. So you see some patients with kidney failures, they actually have blood cancer. So the three major blood cancers I mentioned is the leukemia.
That's the popular leukemia.
The leukemia, yes. That is the one that affects the white cells. Then the lymphoma, the one that affects the lymph nodes. And then you have the other one, which is called the multiple myeloma, which affects the bone. Okay.
Now, this blood cancer now, does it have age, limits? Or must somebody grows to a certain age before he or she begins to suspect, or it can happen at any time?
Yeah, blood cancer can affect any age. Although there are some subtypes that are more common in children, the hematologists will be able to discern, but it affects all age, from the young to the old. But there are some types of blood cancers that are peculiar or more common in childhood, and there are some that are more common in adulthood. So, but it affects all spans. Because if you look at, really, we have not been able to find out what is actually the major cause of cancer. I'm sure you know that. What we talk about is triggers. There are some certain things that will make you prone to having blood cancer. We call them triggers. And we've said so many things about some of the triggers, because the mechanism in which the body forms blood cancer, we talk about two hit phenomenon, meaning your body must have been, your genetic cells must have been insulted once before. So you just need a second trigger to make the cells become malignant.
When you say your genetic cells insulted, now how?
What I mean is that the cells of the body, the cells of the body are the ones that controls most of the genetic makeup. So we talk about an insult to the framework of cells.
Yeah, bring it down to my knowledge.
Yes, what I mean is that the cells themselves, they are controlled by DNA and RNA. Some cells are controlled by some mechanism.
Okay.
In terms of how they grow, when they are to stop growing. So some of those mechanisms must have been insulted by one trigger. Then your body is quiet.
Now, are there things that we unknowingly do?
That's what I'm saying. That's why I mentioned the triggers.
Yeah.
So the triggers, number one, are some common things that, like people who work in petrochemical industries, we feel that some of them, because of the chemicals, some of their genetic makeup of cells must have also been tempered with.
Insulted.
Yes, so they are quiet until they have another hit. We also talk about those who stay under high tension wires. In Nigeria, for example, because we are lawless, and because authorities also are not ready to enforce the right thing, many people stay under high tension wires. So when you stay under high tension wire, they say, nothing has happened to me. Yes, nothing will happen to you, but something may happen to your children, because your genetic makeup would have been insulted. And all you need is another trigger. So those who stay under high tension wire are prone to having some of these blood cancers. Even as simple as our mask, the communication mask, that is being, somebody would be staying in a compound and gives his backyard to one of the telecommunications to put a mask. If you go near those masks, you will hear a lot of humming from radiations. So these radiations are things that, and then also to don't forget too that we are beginning to see more cancers now than before. Because we hear a lot of, there was a time there was dumping of radiochemical waste in cocoa, and people are indiscriminately dumping biological waste everywhere. So these are things that initially triggers off the first insult. And all you need is maybe another insult, and then the cells become malignant.
Okay. Now, when you suspect, all these symptoms now, are there things you can do to manage yourself?
Yes. First thing is to say that we all deserve to have what looks like a medical checkup. Because as I said, some of these things, they start silently. But when you do a medical checkup, maybe yearly, for example, you'll be surprised that even while you are well, some of these things could be detected. So once they are detected, you are sent to a hematologist who follows up. So it may just be something that is snowballing and then is taken care of. Then number two, once we have some of these features, it is better to go to a hospital. Let's take some example. Somebody has all those lymph nodes swollen. And then rather than going to a hospital, we'll be going to traditional medicine for years. And then it's just in a chronic phase until it becomes acute, and then there's problem. Or somebody has a fracture that you cannot explain. If you're going for a trip and you have a road traffic accident and you have a fracture, that is a traumatic fracture. But what if you are going to your bathroom, you want to go and have your bath, and suddenly you slip a little, and then you fracture your bone? That's what we call a pathological fracture. Or somebody just holds your hand, shakes you a little, and your hand breaks. That's a pathological fracture. Something is wrong. So those are signs, and then we expect that once you have that, you should go and see a doctor.
Okay. Now, let's look at, you talked about swollenness now in parts of the body. Now, let's look at our joints now.
Yeah.
People have what they call arthritis and all that. Now, my basic knowledge about arthritis, I'm a doctor, permit me, is that is when you probably have a kind of a blockade in your blood flow and all that. That's when you come with joint pains and all that. So can that be related in any way?
No. It's not related, yes. So the arthritis we are talking about, those has to do with connective tissue.
Okay.
And then has nothing to do actually with blockade.
Okay.
It's an inflammation that has to do with the connective tissue, affecting the tendons and surrounding tissues around the bone. So once they are inflamed, they get swollen. So that's connective tissue disorder that affects the joints. But this has nothing to do with blood cancer.
Okay. All right. So you talked about medical checkup now regularly. That seems to be a major problem in this part of the world. As a matter of fact, a lot of persons are scared. They don't want to hear. They rather just live their life the way they are.
They reject it
than to go and they are told. Now, your hospital, the Igbenedion University Hospital, is organizing, in collaboration with Igbenedion University now, is organizing a free medical checkup. You want to talk on that? Yes,
we are doing a lot. Igbenedion University, IU, is actually the pioneer university in Nigeria. We actually have, we're registered as 001. That's the first private university in Nigeria. And as pioneers of almost everything. In fact, the teaching hospital too is also the first private teaching hospital in Nigeria. So we celebrated our 24th year as a university. And based on that, we are expecting to, we've done the ceremony in the usual character of our Chancellor, the Sama of Benin Kingdom, Chief Dr. Sir Gabriel Osawaro, always wants to give to the people. So in honor of our 24th Founders Day celebration, we have planned to actually give back to the society. And so from on the 5th of June to the 10th of June, we'll be organizing a free clinic. We've done it before. We've seen over thousands of persons. We do them regularly, but this time it's in honor of our Chancellor for the 24th Founders Day. So it will be a program from on the 5th to the 10th. And from 8 a.m. to 4 p.m., we will be on ground to ensure that patients are seen free. Basic surgery will also be done free. And then some glasses will also be issued out, free glasses will also be issued out to some persons who have reading problems. So it's going to be a program that we're inviting all the persons around Okada environ to come over, even those who are not around but can find their way to Okada during this period, they will be treated free.
Do you have your annex hospital in Benin City on Saturday?
Yes, we have our annex hospital in Benin, but we're not doing the program in Benin.
Okay.
So it's mainly in Okada. So we expect that everybody should be able to take a trip to Okada, those who want to. But it's mainly for those in the environment, the UTC and the Egbeta and all those. Yes, because we know that the chancellor knows, we've been doing this before. We have had patients, for example, who could even have some of this malignancy. They've been at home. And then they don't have what it takes to fund health care. So they usually will come over. Because cancer management is very difficult. And then to talk about even taking care of cancer patients. When I was growing up, cancer used to be treated free in this country. But right now, it's very expensive. And the only cure to some of this cancer is bone marrow transplantation, which IUTH, in collaboration with Celtech, we started doing transplant for bone marrow cancers. In fact, we've currently done 4 for the cure of multiple myeloma. So 4 patients across the country have been treated by IUTH in collaboration with Celtech with stem cell transplantation for bone marrow transplant.
Okay. Now, you talk about bone marrow now. That reminds me. Medicine, there's no doubt that medicine is advancing, is developing. Now, I don't know whether medicine has developed in such a way that the effect that comes with the bone marrow transplant now is being reduced. Like your stem cell transplant, the effects were enormous when it started. I understand that patients, they may have to lose their hair, some lose their teeth and all that. Now, for the blood cancer now, even if you have to do the bone marrow transplant now, the effects, are they reduced in any way?
Yeah, I think technology is improving every day. And usually the ones we mentioned, the side effects of losing hair, they're usually transient. And I'm sure by June 19, we'll come up with some of our patients who had heart transplant. And you see them, they're looking like you and I. So during transplant, you have some side effects of some drugs, like hair will fall off and things like that. The skin will be dark. But those are transient. After transplant, once it's successful, the patient begins to, the hair grows back, and all the skin colors are back, and the patient become like you and I. So if you see some of our patients who have been transplanted, both for blood cancers, like bone marrow, multiple myeloma, sickle cell, they look normal like you and I.
But some say that they may have to wear artificial teeth. How true is that?
No, that's not true. We've not lost, patients do not lose teeth. They lose their hair.
Not the teeth.
Not the teeth.
Okay.
So not the teeth. So complications of transplant does not include loss of teeth.
Okay.
So, but generally, globally, transplant is becoming much and much better. But for blood cancers, the only remedy is stem cell transplantation.
All right, I want to say a very big thank you to Dr. Nusa Bazwai, the Chief Medical Director of Igbonedo University Teaching Hospital, IUTH. Talking about the blood cancer, which was observed about 2 days ago now. That was on the 28th now, 2-3 days ago, all over the world. And the theme is closing the care gap. So you as an individual, that you have a role, in trying to help yourself. And of course, he has also told us about the free medical care, the free medical check that IUTH is organizing in Okada. So if you suspect, if you have any of this malignancy that he talked about, you can please go there. And how much will they pay?
Well, registration and everything is free.
Okay, registration is free.
Yes.
The check is free. You can imagine. So all you need to do is to take pay for your transport fare, and you go there. And of course, you'll be taken care of. We want to say a very big thank you to Dr. Bazwai for finding time to come on the show today.
Thank you very much.
Thank you so much.
Thank you very much. I appreciate it.